Insights for Impact using data to advance primary prevention. I've been watching the chat and seeing names come in. It's great to see so many familiar faces, new folks joining in here today. So thank you for being here. We value your partnership as we do this work together. So this webinar is supported in part by the Centers for Disease Control and Prevention of the U.S. Department of Health and Human Services. This is part of a financial assistance award that we have. The contents and opinions expressed here today are those of the presenters and do not represent the official views nor an endorsement by the CDC or the U.S. government. So about 4 years ago now, in August of 2022, we launched what we called the Zooming Out series. It was our opportunity to step back or zoom out, so to speak, and try to expand our understanding of what was going on around us. The point then is to zoom back in so we can take what we learn, transform what we're doing with those insights, and put those into actions in our communities. Now, our focus at Prevent Child Abuse America is on primary prevention. And we do that by creating the conditions so all children and families can live a purposeful and happy life with hope for the future. We know that data have a critical role to play in helping us understand these conditions. Now, when I say data, let me be clear. I'm not just talking about numbers and complicated formulas. I'm also talking about the stories, the experiences of those who are closest to the problems that we work on. Now, today's session, it has what I would call a rock star panel of experts. They have all, I'll introduce them in a second, but collectively, they're going to talk about how data really helps us support families, how we can shape policies when we take what we know, our insights, and we put them into action for impact. Now, as we move through the discussion today, I'd invite you all to think a bit about your current data. What data are you using? What questions are you trying to answer, or do you not have data to answer? And how might you use data differently in support of primary prevention and systems change? Now, like I said, we're joined by a rockstar team today who has graciously agreed to share some of their expertise. They bring unique perspectives to the work that can inform our efforts in primary prevention, strengthen our systems, and really translate information into meaningful impact. Now, they're all going to have an opportunity here in a minute to introduce themselves, but let me introduce you to our panel. We have Ryan O'Donnell, who is the co-founder and CEO of Sunlight. We have Dr. Cynthia Osborne, Executive Director of the Prenatal to 3 Policy Impact Center at the Peabody College of Education and Human Development at Vanderbilt, whom I get to say that I finally got to meet in person this week here in Chicago. Mary Wall, the Research and Program Manager at the Child and Adolescent Health Measurement Initiative, and Emily Wortham, Director of Policy Operations at the Research Translation Platform Evidence Impact Collaborative at Penn State University. I'm going to hand it over to each of the panelists to take a few minutes to really introduce themselves and talk a little bit about their work. So I'll hand it over to you, Ryan.
Awesome. Thanks so much, Bart. Like you said, my name is Ryan O'Donnell, co-founder and CEO of Sunlight. I did not enter this work originally in the child welfare work or policy or from a research perspective. I started my career building technology companies, but back in 2019, my wife and I became foster parents, and I got to enter a whole different world. So many of you all know and felt like I went from a world of like ChatGPT and fast tech startup land to a world of fax machines and snail mail. After selling my last technology company and helping our foster son get reunified with his family, went all in to try to figure out how we can help improve how organizations collect data, use their data to ultimately serve families much, much better in a way where all the families would say that they are actually, being well served by their organizations. So just thrilled to be here. Thanks for having me. And if anyone here is in North Carolina, I'm in Raleigh. So shout out to all of our North Carolina folks on the call.
Well, I'll go next. It's funny that we have O's and W's. We're going alphabetically, and I never go second as a O. So thanks so much for inviting me to participate in this conversation. And it's really interesting to be reading in the chat how everyone is using data in all these different ways. So I'm Cynthia Osborne, and I am the director of the Prenatal to Three Policy Impact Center. We have a very long title, but really our whole purpose is to be a resource for states as they look to implement policies that will create those conditions in which infants and toddlers and their families will thrive. And our approach has been to focus on policies that have a strong causal evidence base, that the research on those policies has been very rigorous, so that we know that when the policy or program implemented at scale occurred, that we actually could see a change in outcomes in some domain of infants and toddlers and their parents' well-being. And what we do is work with advocates and elected officials and state administrators, kind of anyone who is interested, to provide to them both the evidence of what the policies are and kind of how they impact families. We also monitor what every state is doing toward implementing these effective policies. So we're able to answer the questions that folks often have of, well, who else is doing X, Y, or Z? Or is anyone doing something to try to do this particular thing? And then we also uh, look to see how those policies intersect to provide resources for families. So we use data in lots of ways, like you all do. And I'm excited to have this conversation with you today to share more. And I think that my colleague Sarah is going to be putting some of our resources in the chat in case it's useful for you.
All right, I'll go next. I'm Mary Wall from the Child and Adolescent Health Measurement Initiative. We're based out of Johns Hopkins University, and I am going to share a couple slides um, to give you a good visual of some of our work. And our director is Dr. Christina Bethel, and she does send her regrets that she couldn't be here today. So um, just want to give you a quick overview of the work that CAMI, we call ourselves a CAMI, that we do. And ultimately, our goal is we are working in many ways toward the promotion of early and lifelong health for children, families, and their communities. And I kind of think of us as the three-legged stool, where we're working with measurement development around priority goals and outcomes for children and families, and then actionable data and data-driven tools that go along with those measures or actually implement and utilize those measures. And then transformational partnerships and engagement. So taking that information and just like Dr. Osborne is saying, and putting it into practice and getting actual change from the data that we're generating. And so here is our flourishing paradigm. So we think that these are really the core foundations of early childhood and lifelong population health and flourishing. To us, the North Star is child flourishing, and so integrated with that is school readiness. And we know that, and from the research, from the data narrative that has been then culminating over these decades of research, we know family resilience and their ability to really develop an attuned relationship with their children and giving them the supports to do that, as well as the whole system that wraps around families. Is it schools, the healthcare, social services, and so making that a whole system that is focused on relational systems of care. And so we have developed the National Engagement in Action Framework, or the ENACT. We call it, it's just one big doable thing. We can all make it happen. And it's just, again, working toward this goal of healthy children, flourishing children who are ready for school. And it's a through any door approach that engages families with an integrated statewide or nationwide early childhood health system. And I'll talk more about this, but I just wanted to give you a few visuals to help you as we get into more conversation later. And then Okay, and then we have another set of tools that's called the cycle of engagement approach for whole child care. And this is sort of a solution to what the ENACT framework sets up. And so this is a focus on primary prevention, and it is a set of tools for children to be used with children in early pediatrics. And so we have the pre-visit planner tool, which is our well-visit planner, and it helps families, select goals and translate information to the pediatrician, and also receive their information back, receive their data back. It's a personalized personalized connected encounter during the visit. So these tools save time and help develop that trusting relationship with the provider. And then the after visit evaluative promoting healthy development survey. So it gives families a chance to actually provide information to their provider on their experience of care. And so to all together, we think that this is a suite of tools and a framework that can really push the lever on improving child and family health in our nation. And I have to tell you that our very useful resource for you is the National Data Resource Center for Child and Adolescent Health. So we also manage this where we develop and display the National Survey of Children's Health findings, the data findings. And we have, this is a national survey. It is funded and directed by the Maternal and Child Health Bureau out of HRSA. It's administered by the Census Bureau. And it's an annual survey, and there are over 350 measures that you can find every year. And there's an interactive data query here. So here's like quick, don't read this, but look, these are all the measures you can find. Physical health, emotional and mental health, health insurance coverage, access, and then information about communities, schools, families, and neighborhoods. And so here quickly there's a snapshot of the interactive data query where you can go in and put in your state, put in what you're interested in, compare your state to the nation or to other states. It's point and click, and it's all easy access. And so we really focus on data in action, which is what this panel is about. We do many trainings around this. Excuse me. And I'll also add, we have code books and data sets that are downloadable if you want to run your own analyses, but this is also just point and click available for you. So here's an example. This is a new measure that was added to the query in just 2022, and it's the Whole Child Risk Index. And so it's a composite measure. It's a cumulative score of medical, social, and relational risks. And so some children may have none, 1, 2, or all 3. And so this is how we like to use imagery with our data. And so, how many Rose Bowls or how many stadiums with children who are 0 to 17 years old in the United States who experience all 3 risk domains, medical, social, and relational. So it would fill almost 76 stadiums of children who meet all 3 risk domains. And so we know from this that, that whole integrated system for childcare is what's essential to move this information forward. And I'll end on this very high note, going back to this, school readiness and flourishing. There has been assessments around school readiness based on ACEs exposure down in the corner. But we find that flourishing criteria, these indicators are more predictive of school readiness than the risks. So we want to flip this narrative from harm reduction to, positive promotional health. So I will end there, and I'm so excited to be here. Thank you, and I look forward to more conversation.
Mary, I will go next. Emily Worthman. I'm just going to share my screen here real quick. A few slides too. Okay, there we go. All right. Well, again, thank you. I am so excited to be part of the conversation today and just to hear the incredible work that everyone is doing to help children and use data in that way. And I love seeing research have a real world impact. And I really hope that a key point I can leave you with today is that there are often more opportunities for evidence-informed policy engagement than people sometimes realize. So as mentioned, our team at the Research Translation Platform is housed within the Evidence to Impact Collaborative at Penn State. And we study research translation models and how we can bring researchers and policymakers together around shared interest, and so that we can improve the use of research in policy. And again, when I use the term researcher or research today, please know I am using those terms broadly. So including nonprofit professionals who are using research in practice and also including lived experience. So when I think about the why behind our work, why is it so important for researchers to have a seat at the policymaking table? Well, research can have all of these wonderful benefits. It can benefit the public when it's incorporated into policy. It can help us identify problems and also inform their solutions, helps us to know what is actually working, and then as a result, how we can better allocate our public resources. It's also helping shape how policymakers are thinking about issues and thinking about prevention. And then ultimately, evidence-informed policy can help improve lives for everybody. But despite these benefits, we also know that there are barriers to getting research into the hands of policymakers. So how can we address those barriers? Well, the Research to Policy Collaboration Model, or RPC, is one way that we can bridge the gap between the research and policy communities. This model was co-founded by Dr. Max Crowley and Dr. Taylor Scott. We have here a visual of the model, and I want to emphasize that the heart of this approach is really around building trusted relationships. In order to maximize impact, we have to move beyond just sharing information to ongoing collaboration that's really built on a foundation of trust. So to do this at a high level, our team first meets with policymakers so we can learn about their interests, their policy priorities, and their research needs. And then we match them or connect them with researchers who have relevant expertise. And that allows the researchers to connect with policymakers about relevant and timely issues. And then with that ongoing collaboration, researchers are able to respond to needs as they arise so that we don't miss opportunities for research to be useful in this process. And then the RPC model has been extensively evaluated, first at the federal level, where it was shown to be effective at improving the use of research and policy and also researchers' policy engagement. The model is replicable and can be applied to different subject matter areas. And currently, with the support of NIDA, NICHD, the William T. Grant Foundation, and the Penn State Social Science Research Institute, we're now able to study the model at the state level, where we have been focusing on substance use prevention and also protecting children from child abuse and neglect. So I listed a few metrics here because I really just wanted to highlight that there are great opportunities to engage with policymakers. Over the past couple of years, there's been so much interest in coming together and meeting. We've had hundreds of meetings with policymakers, which have led to hundreds of requests for researcher involvement. And researchers have been able to be involved in the policymaking process in a number of ways. We've been having follow-up meetings to discuss and brainstorm ideas with policymakers, provide feedback on draft legislation without lobbying, testifying at hearings, among others. And these collaborations have really been quite energizing because, again, there's so much interest across the country, across the aisle, in having these research-informed conversations about how we can best support children and families. And I wanted to share just a few pictures of our team. This is where we've been going to various state capitals. I hope you can tell here, we're not just smiling for the camera, but we're just really energized and are enjoying these conversations and meetings we've been having. And I think this also serves as a reminder that, we see a lot of negativity in the news. We see a lot of negativity around partisan politics. But again, when you're having these conversations, when you're building trust, when you're behind the scenes, there are so many people who genuinely want evidence to help inform policymaking and to help children. And so if we want research to be useful and to impact policy, we again have to focus on building these relationships. And there are these great opportunities to get involved. Policymakers and their staff want to hear from all of you. Your experience matters. And just to kind of wrap up here, I have a couple of links if we could please put in the chat. This is to TrestleLink, a nonprofit, and also the Evidence to Impact Collaboratives Resource Center. These are a couple of sites that you can go to for more information about the RPC model, fact sheets, and also some policy training resources. Thank you.
Well, I told you all that it was going to be a rock star panel, and as you can see, we have such a strong panel here that come at the issue of child and family well-being from different ways, and that's what I'm so excited about this conversation that we're going to have today. And just before we get into our questions, we had the chance this week, the National Conference of State Legislatures met here on Monday, Tuesday, and Wednesday in Chicago of this week. It's a nonpartisan organization that really provides information to state legislatures as they're making these critical decisions. And they came together for their annual convening. And as I walk away, there were a few insights that I had from this experience. One of them was that child and family well-being was central to many, if not all, of the conversations that I was part of and the presentations that I attended. But really, I think building on Emily's last point, what struck me most was walking away from this conversation, from these conversations and these panels, and seeing people from both sides of the aisle coming together, really joining forces, not in opposition, but saying, on this issue of SNAP, on this issue of housing, on this issue of paid family leave, we have common ground because we know if we can support families early and build that continuum of support with things like paid family leave, childcare subsidies, housing, all of these things, that families are going to do better. They'll stay employed. They'll contribute to the economy long term. And so I was just very struck at the ways in which I saw collaboration occurring around many of the issues that we're going to be talking about today. So let me get into my first question. And this is a very broad question because you all come at these issues from different ways. But if you could each just talk about what do you see as some of the most compelling research or trends or data right now coming out about child and family well-being? And I will go ahead and start this one with Cynthia.
Well, thank you. And Bart, yeah, I was there at NCSL as well and agree 100% that these are folks who are really interested in solving problems and finding those solutions. And I've heard them actually say, if you could just bring me those solutions and I can, figure out what to do because they don't have a lot of time to get into the weeds. So in terms of some compelling research, so I'm a research nerd. I'm a professor by training. What I do is I look at research all the time and we're constantly kind of scanning every paper that's being written, assessing whether it will tell us more about which policies are effective or how families are faring and that sort of thing. And it's interesting because when we're kind of engaged with this, we're often getting way down into the weeds, but it's those kind of pieces of literature that really kind of change our perspective or change our way of thinking. And I just wanted to share with you a study that came out fairly recently. It still actually hasn't been completely published yet. And so there's been for the past couple of years, there was a study that showed that the correlation between third grade test scores and 11th grade test scores in reading, the correlation is 0.92. I'm often asked to describe what a correlation is, and it basically just says kind of what you score in third grade and reading is what you're going to score in 11th grade. 0.92 is really high. The highest can be 1. And this new study, though, showed that the correlation between your kinder readiness assessment score and your third grade reading was 0.72. And that is something I've been sharing more and more with elected officials or anyone who will talk to me, because that just speaks to how important it's this, we've been saying this forever of how important the earliest years are, but we're often so focused on school readiness, and to be able to say, yes, school matters, absolutely, but it's what happens before they get to school. And so there's just sometimes these studies that come out of, like that really give us that data point that we've been hungry for. And I could go on and on about compelling research, but those were the ones that were kind of like, this is what I needed in order to help me with my argument.
And Mary, what about you?
That was a really good lead up. So thank you. Um, no, that's right. And so, so much of our research does focus on how do we effectively promote positive childhood experiences, right? And family resilience and parent-child connection, and specifically through primary prevention strategies, right? Like our well visit planner tool. Um, and just building on what Dr. Osborne's saying, so I just want to highlight there's more research coming out about flourishing, and how it is predictive of readiness to learn, school readiness. And we need to really highlight that flourishing is not the absence of risk. It is not the absence of illness. Right. So some of the flourishing attributes that we use in the measurements is a curiosity about learning, emotional, relational openness, resilience, and self-regulation, depending on the age of the assessment. And these are all strongly associated with learning and lifelong health. And they can exist. Flourishing, it can exist amidst adversity, and it can be absent in children who are not experiencing adversity. Right. And so we are really honing in on this opportunity that is the early relational health, but within the family to foster that child flourishing. And so, for instance, something that we're looking at is that children with no social health risks, but have relational health risks, like adverse childhood experiences, can still flourish and succeed in school when they also are experiencing that strong parent-child connection, when they live with families that experience a strong sense of hope, or they have strengths to draw on. They're prioritizing staying connected during difficult times, and they're reaching out for help. And all of those things I just said, those are attributes of family resilience and connection. So, and all of these, sort of terms or measures, they're all measures you can find in the National Survey of Children's Health. So we are starting to create this coherent narrative about what families are experiencing across the country. And then I just want to highlight that. And we know that primary prevention, this sort of through any door, is the ideal approach. But right now, pediatrics is like one of the best opportunities for those touch points with families. We know that by the age of 6, so you'll have started school by then, 5 or 6, there are 15 well visits that occur. So 15 touch points with your pediatrician. There are 9 that occur before you're 18 months old. So there's so much exposure and so much opportunity. And so it's that really, that effort of having that integrated whole child or, system approach to care. And then I'll just say one area that we really are looking forward to more research around is right now there is a positive childhood experiences index, and that it can be completed and you can get a score, just a personal assessment. But right now it's only validated for adults to report on their childhood. We do, and it is being used with children. So we need to further the field by having an actual child appropriate tool. So that's where, thank you.
Emily.
Thank you. I think one of the things that's really exciting is we do already have a wonderful body of research that tells us how we can help children, as Cynthia and Mary have been highlighting. I would also point to colleagues at the National Prevention Science Coalition for Saving Lives, NPSC. They have been really highlighting that research. They have recordings that are available on their website. So if you're wanting to see some of the current research in the prevention space, that's a great resource. And then for my work, I'm not personally conducting the research. So the lens I kind of approach this with is what's going to be compelling for policymakers? What are the policymakers wanting to know about? And so with our projects over the last couple of years, as I mentioned, we've been meeting with policymakers all across the country and have really seen a few themes coming up from these conversations. So just to give you a few examples of that. There are a lot of policymakers that want to help children. They are fully on board with the idea of prevention, but they don't know where to start. Or they recognize that this is a really complex problem and they don't want unintended consequences when they're doing well-meaning solutions. So they ask us, what's something incremental I can do? Where can I start? What are some examples? Also, budgetary realities. So they're asking us, what's cost effective? What's low cost, no cost? What's the ROI? How can I talk to my colleagues about what this investment is going to do short and long term? They also want to know what is and what is not effective so that, again, they can use those resources widely or wisely. And then we also see two things, just to kind of wrap up here. On one hand, they want to know local examples. And this is where some of that storytelling and the lived experience is really wonderful to bring into the conversation. So they want to know what's relevant to their constituents, their districts. On the other hand, we also get a lot of questions about what's going on in other states. What are examples of best practices? And we don't want to reinvent the wheel. So can you share with us what other states are doing? So those are some of the questions that we get from policymakers. So any research or insights that address those, I think, are very compelling.
What about you, Ryan?
Yeah, I think you bring up a really great point about like what does it actually take to get a legislator to actually move the needle and like walk down the hall and have a conversation with one of their colleagues about an issue that they probably are very passionate about, but they might not necessarily have good data to communicate to someone who maybe isn't as well informed on a particular subject area. And that's why I think it's so important. Like now we have this like incredible opportunity because we have so much data, right? We have so many examples where you can go to almost any conversation armed with a variety of different data points to help make your case, right? And to communicate that in a way that's going to resonate with a number of these different groups, right? So just to give an example of this, one of the things that we've been working on here in North Carolina is around post removal with child welfare involvement, not having any semblance of consistent communication from the courts, right? In North Carolina, we've got plenty of research around court hearings being delayed and that leading to children being stuck in care, often for 3 months, 6 months longer than they need to. So when meeting with some legislators, we say, hey, we've got this problem. We've got a backlogged court system, and this is what it's costing our state and the attorneys that we're sending into court and the time off that everyone's having to take. But then for others, it's much more grounded in like these are an extra 180 days a child is separated from their family. And being able to pull on those, I think, is just really important. And figuring out like what is the data story, what is the human story associated with each of these. Like, I don't think we've ever had this much data. And it's a really great tool that we can use whenever having those conversations.
Well, as you were all sharing it, it sort of reminded me back to my training. I was trained as a social work researcher, and so much emphasis was put on making sure that you've got a really good research question and making sure that you're doing everything you can to do the most rigorous research. And I remember younger Bart, as when I was a young researcher, being so excited the first time you're in a project and you get this finding and you think that this finding is going to save the world. And so you say in your paper, this has implications for policy and practice, not really knowing what the heck that meant. And I remember presenting at one of my first conferences, and I'm all excited, and somebody in the audience raised their hand and they said, "So what? Like, what do I do with this?" And it really hit me at that point that it has been my quest to, as a researcher, to really think about answering the questions of policy and practice, not answering questions that are just substantively interesting or because I have the data to do it, but to really think about if I'm going to spend time answering a question with research, is that have any application? And I think one of the things that we'll talk about today is just things like partnerships needing to be in place to ensure that. But one of the questions I always have is I'm on this quest to ensure that we're not perpetuating this 17-year from research to practice gap that we currently have. What are some examples that you all are seeing of individuals, places, states that are doing a good job of using research for actual action? And if you could just speak to examples that you've seen, and I'll let you all decide the order that you go in.
And this is where everyone stops talking. I'm happy to jump in here. Bart, a couple of things were coming to my mind as you were talking. When researchers join our network, I often hear them say, I don't want my research to suffer from the dusty shelf problem. I want it to be useful. I want it to get in the hands of people that can use it. And so that's kind of a driving force in our work, is to be able to make those connections. And one of the things I think is really meaningful about developing trusted relationships, where you're not just having one meeting with the policymaker and then sharing a fact sheet and that's it, but you're having these ongoing conversations. It can be a bi-directional conversation. So the policymakers can learn from the research side, but they can also say things that then inform the research questions. So then that helps it get back to being useful. And just to share one quick personal example, I was in some meetings with an official and their staffer, and they were wanting to address child abuse because they had seen these tragic examples on the news. So it was front of mind for them, front of mind for their constituents. Had the researchers come to these conversations, and they started again to think about, okay, this issue is a little bit bigger than I expected. If I try and tackle this entire system change, here's these unintended consequences I'm hearing about. So they really listened to that feedback from the research community. And so then they started to pivot their approach as a result and started to say, okay, here's some incremental steps I could take. And then when they introduced a bill, they included an idea from the researcher about data sharing across agencies. Policymaking can take some time. Sometimes you meet with somebody and then you find the effect later. But this was one of those really exciting examples where we got to see repeated conversations and then a very tangible outcome as a result of that.
I'll piggyback off of that, just unrelated to further upstream, I guess, from an experience that I had. I'll share a brief story about one stat that changed my life that I think is fairly indicative of what's possible when folks have a good understanding of their own organization's data and what the work is like, not necessarily in theory, but in practice. So if you turn back the clocks to when I was in high school, I was a part of a team that broke the world record for the largest food drive in 24 hours at a single location. So we raised more food faster than anyone anywhere in the world. And for, a very long time now, no one has come close to breaking it, right? They had the food bank had to get a whole new warehouse for this, right? And we're on top of the world. We think we're going to be in the book, and we take a picture, and the COO of the food bank is congratulating all of us. And then he says, because we're a bunch of nerds at School of Science and Math in North Carolina, y'all are good at math. We distribute 100,000 pounds of food every operating hour. The world record is for just under 600,000 pounds of food. So, we can all do that math. This is the world's largest food drive, and it doesn't even last 6 hours. He knew that stat off the top of his mind. He could tell that to me in a passing conversation, and would have no idea that would have significantly changed the trajectory of my life. And I was like, oh, we should go fix that. Now put that in perspective. What does a 1% cut to SNAP do? It's thousands of world record food drives every day that never happened. And I say that to the policymakers who will wonder, hey, you did this big food drive. When are you going to do another one? And I'm like, I would love to. We've been trying to do it. But if we could preserve some of these programs or have some of these programs better designed, that's a much better lever where the scale just can't compute. And I think we're getting to a point where it's easier to make those arguments And I think, part of why we called the company Sunlight. Sunlight's the best disinfectant. We've got great data to highlight those differences where someone might have a particular point of view, but if you can present them with data that shows they might be off by like 1 or 2 orders of magnitude from where they actually want to go. That does change a lot of those dynamics and can break like old patterns of thinking that might be, making them go down a different path that is not going to put the best practices in place and make sure that those actually deliver.
Yeah, that's a really interesting kind of fact that you provided and would be so compelling to lawmakers. So just to build on what you've both said, because I agree with it so much, especially about these trusted relationships. The thing that we are seeing more and more is that people come to us and say, we have this sort of problem, or we want to do this. Can you tell me, more? And that came from being this trusted voice that tells them when they're right and tells them when they're wrong, tells them things they want to hear and things they don't want to hear. We're not advocates, we are analysts, and we spend our time, as neutral as we can to what the evidence says. We could talk a long time about the fact that evidence itself is in research is never just completely neutral. But that builds trust really quickly. And so when you ask me, will this work? And I tell you, there's no evidence that that's going to work. It could, but no one's done it before, or it was studied, it didn't work in that context. That builds a lot of trust. But we have a couple of examples um, where we've actually been able to, no, Emily, I think you said policy is a long game, and it's hardly ever one piece of information that, sets all the dominoes in motion. There's lots of players. But one of the things that we do is benefit cost analyses. So we understand how much your new policy or program costs to implement, and then we use the most rigorous causal evidence to, it's been done to understand what the impact would be on outcomes and what the dollar value attached to that would be. Because this is, unfortunately, when you have to use scarce public dollars as efficiently as possible, even when you care about little ones, you ask, well, how much will this cost? How are we going to pay for it? And what will we get out of it? And we do benefit cost analyses in the childcare space, in tax credit space, and paid leave space. And one example, a couple of years ago in Virginia, we did one for their investments in childcare. And we were able to show that the nearly $400 million that they spent on these additional dollars spent on childcare led to over 11,000 new jobs. And this was all stuff that was happening that year, and it would happen year over year. And yes, we could put in all the things that would happen when the kids entered school and what that would do for, their academic trajectories and all their life trajectories. But that's way outside the election cycle. And so the elected officials need to know what's happening today while I'm still here in office and what I can take credit for. And the governor cited our study as one of the reasons that he maintained and actually increased the funding. We also bring policymakers and the advocates and kind of the voice of those with lived experience and state administrators together to in state teams to our policy academies. And there we talk about a particular issue, like just as much as possible. What's the evidence? What are folks doing? What would you need to consider? And they often will leave that with legislation in mind of what they'll go back. And we did one in November on tax policy, and Rhode Island used what they did in that academy and introduced legislation and passed it. And so there's a new child tax credit now in Rhode Island. So, there are times in which you can really see your research being useful in these conversations. But trust is at the heart of it.
I can add just a little more too. I had talked about our the National Engagement and Action Framework, or the ENACT, which is uh, it was developed in coordination with the Mississippi State, their Thrive Child Health and Development Project. So it was a HRSA funded initiative, um, and the framework was sort of like the icing on the cake, right? Like it kind of came out of the work that they were doing, because it was like, oh, this could be replicated anywhere, right? But one of and it's really like a methodology for engaging the partnerships and engaging families. And one of the activities was a mapping activity, accountability measures, performance measures, priorities, across early childhood, across Medicaid, across Title V. And it was an opportunity to see what everyone else was doing. And so and an opportunity uh for partnership, right? Once you know what each other are working on, and then it was a map to say, okay, now these are the gaps and these are the opportunities, right? But that was just one activity that gave so much good information. But from that came the partnerships, right? And it was the conversation starter. Um, and okay, and then another piece I'll add. Is that I want to go back to the National Survey of Children's Health. And so I had mentioned a lot of these new measures that we're finding. And so the National Survey really started in only 2001, but there was a big change in 2016. So there is sort of two sets of information. And so since 2016 and on, uh, um, that's where we're really, we're starting to see these trends. And I don't think I mentioned, but we're going to have a new trending feature so you can compare across years, which is really exciting. It's coming soon. Um, but by having this sort of national state level information available, it can change the conversation, right? And I know, I know you're saying like, but we want more change. But the conversation has to change somewhere, right? And we have to guide that change. And so back in 2019, we were invited to speak at Dr. Patel spoke at the U.S. House hearing. It was the first of its kind on preventing and healing childhood trauma. And so from that came sort of a federal policy shift that was going to, work to put into the language, about preventing ACEs, or adverse childhood experiences, and prioritizing family-centered relational health, right? And after that, funding opportunities start, from congressionally approved funding streams like HRSA and NIH and SAMHSA started to really include the adverse and positive childhood experiences language. So it's changing the conversation so we can keep building the evidence. Yeah. So.
You just add
So
one
many,
thing to build on? Oh,
or go
sorry,
ahead,
Bert.
please do.
Oh, thank you. I just wanted to offer one piece of encouragement, especially to anyone who might want to get involved in policy and hasn't before. A couple of the phrases we just heard, building trust and also conversation starter. I want just a takeaway to be that you don't have to cover everything in your meeting with a policymaker. Saying, I don't know, or I will get back to you, those are ways of building trust, and those are perfectly acceptable. And it really takes a village to do this work. So we can always follow up after a meeting, connect with colleagues, and take a team approach with us.
Yeah, go ahead.
Can I add one more thing too? No, just I also wanted to like highlight the need for being able to do like collective storytelling and have like a shared understanding of what data each org is doing. I mean, if I nationally, now have a federal definition of like what a family resource center is, right? Many of the customers of ours for Sunlight, we've got networks of groups where they have a common shared understanding. They have a common data model, common logic model. They have a common language of talking about number of families served, number of children served, being able to break that down by jurisdiction, by organization, by any sort of criteria that they might want to have. Having a common like vernacular when we're talking is really helpful, but it also the power when you go in front of someone and you're representing your entire network, as many of you all on this call are, and being able to say with confidence, we served X number of families. Our organizations have, spent, 10,000 hours in this community, and this is what we're telling you. Like, you're not just coming there with a research paper. You're not just coming there with another state did this, we should too. It's like, no, the neighborhood down the street that you have a friend who lives in there and a nonprofit's executive director who you've been to their fundraiser. They're encapsulated in this stat that we're about to share. It's so being able to have that like common language is really helpful, and just being able to speak as much as you can in like one voice with confidence, I think, is something that they are not used to hearing in this space sometimes.
Yeah, I think from your comments collectively, I think, some of the things that I'm pulling out is this idea of partnership around the use of data. And, our president and CEO, Dr. Melissa Merrick, always says, prevention happens in partnership. And I think that partnership is built through trust. And I think that was another piece that I heard you all talking about is not just that trust is important, but ways that you facilitated building trust to be able to make sure that as you had said, Ryan, we have a lot of data out there. How is it that we get people to understand it? And Cynthia, you were sharing as well that like when you can be that trusted neutral source and you've built those relationships over time, then people are going to actually use it. And you do that by showing up consistently and doing stuff that is really relevant for constituents of decision makers. Now, we've talked some already about, sharing data. At the very beginning, I said, my definition of data is not just formulas and numbers. It's also the stories, the experiences of those who are most impacted by the issues that we work on. And so my question has to do with, how in your work are you integrating the experiences, the stories of those with lived experience into the work to tell the story that maybe the quantitative data doesn't tell, that might give texture to the quantitative data. So if you could just speak to how you're doing that, or if you know of others who are doing a good job of this.
I'd say a few years before we like officially launched Sunlight, we had this crazy project to build what we called Yelp for social services. It was a fun project. We aggregated over 100,000 public reviews on over 10,000 social services agencies and ranked everyone 0 to 5 stars and had wonderfully rich descriptions of people's experiences with all these different agencies, food banks, local child welfare offices, local family resource centers, everything. You can imagine some people did not like what their scores were. And I think it's a great index, honestly, of what are the people who are actually being served by your organizations going to say. If you're giving away free food, that should be a 5-star experience. And if it's not, like, what are we doing? We ran a similar program with, if any of y'all know Sarah Winograd, together with Families in Georgia, where she sent out surveys to all the families that they were serving and asked, how are we doing? They didn't get back a 5-star review. They didn't get back like a quote. They got back videos. And then that became some of the best content that they had to share with their team, why they do their work, with their funders, why they do their work. It's the first time building a software product I've ever cried listening to some of the ways that their team has impacted the lives of the families that they're serving. And they talk about the work and they talk about the people very differently. They don't talk about, I worked with this organization, I'm in this program. They talked about Sarah. They talked about each person who actually was in their home who made a positive impact. And that we've tried to coin that as like, what's your like proximity index? Like when you actually look at that, like, are you getting that level of data? Or are you getting, in some cases at the individual org level, further removed? A survey once a year, twice a year is not going to capture that, as opposed to like a real-time interaction. How frequently are we talking? What are they saying? Those types of things you can collect with good tools, good systems in real time, and it captures all of those like beautiful stories in a way that sometimes you can't get it any other way, So just huge fan of just asking for feedback and telling like, are we doing a good job or not? It's a great place to start.
Yeah, I think that's so smart. Given that we really are more on the data evidence research side of things, and that's our lane, right? Like that's our comparative advantage. We partner with those who interact with those who, are living this experience or needing the policy or have stories to tell. And it's usually the advocates that, will have those sorts of connections. And so advocates will often ask us, I've had instances where, like, we walk the hall together going to different offices, and I come as the author of a brief or something, here's all the facts, and they're bringing someone who can actually share a story. So that kind of heart and head combo. And as much as I'm a data nerd, I think it's so imperative that we keep in mind that every single data point is a person's life, right? That they are sharing with us in some way, and we have to respect it as a person's, well-being and life. And um, so when we talk about things, to similar to what you were just saying, like this is not just about here's some random statistic that you should, care about. These are actual people's lives who've shared this and what the implications mean. So I think that as researchers, we have a responsibility to not just say whether something works, but for whom, under what conditions, to really keep in mind that these are individuals that are sharing. So.
Love that. And I have a kind of a similar example where I went to a Hill Day, had a number of meetings scheduled, and then researchers joined me. And so we had a researcher and a practitioner, and all the meetings centered around school-based prevention. And what was really cool is they were able to share data at a state level, but then also at a local district level. And so that when we met with each policymaker, they could tailor it a little bit so that they knew what was most relevant to them. But then they also incorporated these really compelling stories. They were talking about coordinators and student assistant programs. And so the coordinators would find in one school there's a vaping problem. They would find in another school there are students who are unhoused, and they learned that having a laundry service was really meaningful for those students. So they were able to take like all of these evidence-based practices, have these stories and how it impacted individual students, coordinators, teachers, and then also what is the data saying as a result of that in terms of those education outcomes. So that was a really meaningful experience. And then just one kind of higher level point. Um, with sharing these lived experiences or with sharing research or data just generally, one thing it's helpful to keep in mind is just the political context in terms of the where you're at in the policymaking process, because how research can be used can vary. It can look one way if you're having an individual meeting with a policymaker and you're brainstorming ideas or you're trying to raise awareness on an issue. It can look different once you get further along and you've drafted legislation and now maybe there's an opportunity for a briefing or testifying at a hearing. So, and then other times there's distractions, there's elections, there's budget season. So just knowing the context can also be helpful.
And I'll just briefly add, just like Dr. Osborne, we are we are also, we provide technical assistance more at the state level typically. But we are like we kind of joke, we're the data liberators. Like that's our role, like we our role here is to make it available to you and to help you understand it. And that just, very minimal kind of key points around using it. It's all you need to kind of to go forth with your message, right? Yeah, no, and I just love the use of all these analogies and these pictures, because that's exactly how we do our trainings, like put a picture in the mind, and what is that? And this is where the relationships come back in, right? Like what's important to who are you speaking to? What's important to them, and that is going to get them moved, right? Um, so yeah, that's all I'll say for now. Thank you.
So time flies when you're having fun. I'm realizing that, oh my goodness, we could continue on a lot longer. So I have about enough time for one more question for the panel, but I want to encourage the audience at this point that if you have questions, that we've added in some time for questions. So if you want to put any questions that you have in the chat while I'm sort of getting to the last, actually it's 1.5 questions that I'm going to ask the panel here, but really, if you could comment on, we've talked about, okay, we've got great data, we can build partnership and relationships, but in your experience, what have you seen that is making it difficult for what we know to get into policy and practice?
Well, I guess I can start on that. So I think as a professor, I can tell you that a lot of it is our fault. That similar, Bart, to what you were saying before, we love our research and we take our time doing it and we know every nuance of it and we think it's the best thing ever. And that kind of nuance, that time, all of those are really difficult for policymakers who need to know right now with their data, their state. They need certainty. They need you to say, does this work or not? And you can say, well, if you hold one hand up and you kind of look this way, it probably does. But all of that drives them bananas. And so, what they're looking for is not the results of one study. They're looking for a body of evidence that is convincing, that are solution oriented, that's not just telling them about the problem, but telling them how they can fix it. And we're really cautious about ever making those sorts of declarations. We're much more comfortable with that last sentence. And this has important implications for policies aimed at strengthening families. I've read that, I've written that myself way too many times. But not everyone is cut out to do translational work. Not everyone's cut out to do applied work. And that's good because I need them to do that basic science to tell us how the brain is developing. I need them to do the policy analysis to tell me what works. But if you're going to get it into the hands of folks who do it, it's got to be on one page. It's got to be simple. It's got to be straightforward. It's got to be conclusive. And researchers just don't like that.
I'll piggyback on that. Yeah, I think, yes, totally agree. But also I would just say, I think sometimes we mistake doing something for actually achieving an outcome, right? And so it's like we're all busy, we're all doing things, but like, what is the focus? What is the goal, right? And are we really outcome focused? What do we always say, start where you want to end up. Where are we going? And just getting very clear. And then just, thinking if you are looking for data, don't use bad data. Don't use the wrong data. Take your time to find what you're really looking for. Don't make square data fit into your round outcome, right? And so just making sure that we're, yeah. Thank you.
agree completely with everything that's been said. Some of the other things that we see, just the logistics of getting a meeting. You could have identified the champion who cares about children, cares about research, but it can take multiple rounds of emails. It can take multiple phone calls. It can even take, in some states, dropping in person in order for you to even get the meeting. So sometimes that foot in the door, it can be a challenge. Not everyone has time to do that. And so that's part of what our team does with the RPC model, is to help with some of that legwork to kind of remove that barrier. Definitely the theme of the day, relationships. So lack of relationships, lack of meetings, that's definitely a barrier. Certainly the different norms that have been discussed. And alongside that, there's often a lack of training in how to do this translational work and the policy engagement. Shared the Trestle link earlier. There are some free training resources that go into some of this and tips in more detail. So I encourage y'all to check that out. And then just one other thing that kind of came to mind was, in our work, we found it's so important to just be human. That's what we always kind of joke about, just be human. We're humans interacting with other people. Policymakers are so used to people coming to them with an ask, trying to change their minds. We're there to be helpful and to share productive information. So that mindset shift can just be really helpful. And some of our messaging studies found that even just sending an email that says, "Thank you for your time," can improve the chances that they're going to have a follow-up meeting with you. So I think kind of the flip side of that is not doing those things are some of the barriers.
Yeah, I'll just add briefly that, that from my perspective, we have passed a lot of laws. We have plenty of policy. There's no shortage of action that has been taken. Whether it's perfect or not, like history will be the final judge of that. But I think it's okay to say if something's not working. And I think lawmakers and like even within our own organizations, we don't want to say, we don't want to offend anyone. We don't want to say anyone's programs were bad, but sometimes we got bad programs. And it's okay to name that. We need those dollars. We need that time, people's energy spent on good programs, on things that are going to work. So it's not about, tearing something down. It's about like building something that's much better. And, to that end, like we had taken a look at the Home for Every Child initiative and said like, hey, this is a interesting way to frame a goal within child welfare world. And, if you were to ask anyone who has seen it, they might say it's all about recruiting foster parents. So we wrote a white paper around, well, actually, what would this look like if you had to achieve this goal without changing foster parent recruitment? And you only could improve that metric by reducing unnecessary entries into foster care. What would that actually take? And then we broke down all that data to spell that out. And I think like translated, we've passed policy to now we want to achieve the outcomes is a lot of times it's like, well, what tools do you have? What systems do you have? Are those well funded? The number of organizations that we spend time with who lose funding or can't get funding for evidence-based work is insane to me. Being able to have like good tools that help you unlock the funding to do the good work so that you can go do more good work, like that to me is the bridge that we want to be able to cross for so many of these orgs.
Just a super fast build on that. Sometimes we've had policymakers that aren't even aware of the ways that they can get funding. Like Family First Prevention Services Act, we've had meetings where they don't know it exists. Federal dollars are staying on the table. So that's part of an education piece as well.
Yeah.
And I think building off of that point, I think another one of my reflections from this week being, at a meeting with a bunch of state legislators is that I oftentimes personally forget the number of issues that an individual person is tasked with being or having expertise on. And so just as I'm talking about the importance of SNAP, somebody's waiting in line behind me to talk about energy policy, and the person behind them is waiting to talk about public land issues. And so part of the education piece too is it's because I know sometimes my reaction can be like, well, why doesn't everybody care about this? And it's not about caring, it's about bandwidth and thinking about the number of things that people are balancing. So seeing at this point questions not rolling in, I'm going to do one final question for each of you, or it's one final question. And just, I would say in under a minute, if you could answer the question, what is one action that you think people in attendance today could take, leaving here, that would have meaningful impact on taking insights and putting them into practice for impact?
I'll start by saying one of the things we've been really excited about is working with National Family Support Network and building out a national database powered by Sunlight. I know many of the groups here are part of family resource centers that might be involved in their work. That's something that we're really excited about, and I think there's a really great opportunity if groups are trying to figure out how do they track their data in the first place. What we heard was like half of family resource centers have no tools to collect their own data. And I just think that's a great place to start, is just asking, where is our data? How are we tracking it? How are we telling those stories? Asking that of the organizations that you're a part of, I think, is a great place to start.
Yeah, I think building on that, first, people often are quote unquote afraid of data. I don't know how to use it and so forth. I mean, I would just say forgive yourself for that right now. Surrender to the idea that there is, lots and lots of ways to use it. The only thing is that we typically only go as far as saying, did we serve everyone we said we would serve, and did we spend all the dollars that they gave us? And as an organization, I want you to, think about how you push forward to continually try to ask that question, do we make the impact that we wanted to make? And you can do that in lots of ways. And I would say download your state's roadmap on our roadmap that maybe Sarah, you can put back into the chat there.
And you mentioned fear of research. I also see in my work fear of meeting with a policymaker, especially if someone hasn't done that before. And so I think a first step people can take in that regard is to figure out who is the champion of the issue. Some people try and just do like mass outreach, but it's often more effective to see who is positioned to work on your issue, who's leadership of a relevant committee that works on child-related issues. It makes it more targeted, more relevant. So I would encourage everyone, if you're not already familiar, to go look at your state legislature's website, take a look at the committees, who's on them, and try and identify who you would reach out to.
Yeah, so I'm definitely going to tell you to go look at your state's National Survey of Children's Health Data. Pick any topic, and here I'll share that into the chat. Also, there's the link. But go to the query, pick any topic, and just look around and see how you compare to your neighboring state or to the nation. And then I think the other thing is, where is a new partnership that you could make? Just you've been thinking about it, and so make that happen, right? What can you do just to engage someone new that's working on the same thing, and how can you work together?
Well, I will just say I will also put in a plug. We're very excited at Prevent Child Abuse America to be unleashing our data dashboard, the Family Wellbeing Indicators, that really tracks many of the outcomes that are associated with our blueprint for family well-being. That will be released next week. So we would also encourage everybody to take a look at that. If everybody could please give a big round of applause, give the thumbs up, the hearts, the clapping to our panelists today. We want to thank you for taking your time to be here. This was a great conversation. We also want to stay tuned, have everybody stay tuned for our next session, Zooming Out session in August on zooming out on the topic of purpose. And if you haven't already heard, our 2027 PCA National Conference will be held in Chicago next summer, August 3rd through the 5th. So more information to come about that. And I'm also excited to announce an extension to this Zooming Out series, something that we call Zooming In. So keep an eye out for a companion resource that's going to really be designed to help translate some of the insights that we talked about today into meaningful action in your communities. So thank you all for being here. Thank you all for the work that you do. And we hope to see you at our next Zooming Out session. Thank you.